relationships between nurses is an area that we don't often consider when we're reviewing errors, and that the relationship that they might have with their colleagues does have an impact. That if there's some tension between them, that they may either want to avoid each other or they may not want to be involved in carrying out a task together, or they may hurry it just to get it over and done with.
I was working a AM shift and was approached by another registered nurse to co-sign some heparin out with her in the medication room. I actually didn't want to be in the medication room with this particular RN. We'd had a previous, not an altercation, but a heated discussion on a night shift where she'd made me feel very uncomfortable. I did ask her if she could find somebody else, and she had asked other people, but there was nobody else available. So I went in as the second signature for the medication. She was a registered nurse that had been working for over 10 years, and I assumed that she knew what she was doing with heparin. It's not a medication that I'm familiar with. 2 hours later she came and approached me and said, we've made a medication error. We've given him 30,000 units of the heparin instead of 3,000. My heart sort of leapt down to my stomach. I realised that heparin is a very high risk medication and the dangers that would put our patient in. So shock, anger at myself, but the priority was patient safety.
The key things I think that contributed to this error, and I think we learnt this mostly in hindsight, was the fact that we had a difficult relationship between two nurses, and I think that there were some assumptions that were made on both their parts. I think one nurse looked at the other and thought she's been nursing for a number of years, and so she must know what she's doing. And for the primary nurse, she felt that the nurse who was checking with her actually had knowledge about the medication.
I've learnt that open communication with all our staff members is vital, that quite often you have to leave feelings at the door. On our ward we now have an independent double checking in a medication room. We've made some changes through not having more than one drug chart in the medication room. The high risk medications are now highlighted in bright yellow, like sort of road stickers, which is really good. Conversations in the medication rooms are about medications only, nothing else.
The advice that I'd give to others, particularly perhaps nurses who are in charge of a ward or who are in a senior position, is to consider about the education that your staff have and their understanding around the management or the administration of high-risk medications, and that the real possibility of errors occurring. And when errors occur with high-risk medications, they can be quite catastrophic. It's really important that nurses, when they're giving a medication, particularly a high-risk medication, that they check and make sure that they have correctly understood the dose that needs to be given, how much is being given, what's actually written, that it's correct. If they're not at all sure about anything, I think they need to just ask somebody else, double check, keep asking until they're really satisfied that what they're giving is the correct amount.